Welcome back to Surviving and Thriving, where we talk about IC, chronic pain, and mental illness, and a variety of different topics. Hey everyone, welcome back. I'm excited to talk about something different today that kind of stems with the nervous system stuff, but it was kind of just a good reminder for me. So I was listening to a podcast that was talking about what does it look like when you get relief from chronic pain. If your main cause was nervous system dysregulation, which I know I've stated in my other videos that when your body feels threatened, it goes into a state of panic and can cause chronic pain because your body thinks there's a threat or something dangerous happening, which can be caused by trauma, anxiety, never feeling safe as a kid. It could be just maybe having a people-pleasing type personality. Can really be anything that's making your nervous system feel like it's not safe. And I want to reiterate that it is not something that you're doing wrong. It's just your body trying to protect you. So for me, I've been doing this nervous system work for about a year, and I always mention about how you need to have small wins in order to keep pushing through. Those have been what have kept me staying positive, and on the harder days, reminding myself, you had this happen and you've made it. And I know I've talked a lot about that my journey has not been a straight line, and that healing is not linear, and my journey may look so different than yours. But Grace, Healing with Grace, the podcast that I talk about, she's a holistic therapist that's in the bladder program that I'm in. And she has like trainings that we can watch, and it's an amazing thing. I highly recommend it, and I mention it in my other videos. But anyway, I want to talk about what she said in her podcast episode, which really kind of resonated with me and reminded me, and I wanted to share it with you. So it's pretty much her talking about how when our bodies are in the fear cycle and the survival mode, it's hard to even come out of that and start to recognize that these symptoms or these things happening to us are not dangerous, to not panic, to not just stop everything. Because when you're in that state, you just are surviving. You're barely making it out of bed. You might be like on your last nerve going to work. Maybe you've had to quit your job. Maybe you wanted to go do something fun, but you're not feeling well. And it's just like your symptoms are overtaking you and you just can't handle it. Well, I've been there. I spent like the first part of joining this program and a majority of my IC journey always giving in to the symptoms. And it's not like a criticism to myself or a criticism to you, because this is not an easy thing. And even Grace has said that the fear is still going to be there, but you learn to relax more and more, and your body learns to let go as time goes on, as you start to do these somatic practices and these nervous system relaxation techniques. And as you learn more about your body and what works for you to keep you safe, you start to slowly branch out to more small goals, and you start seeing results, even if your chronic pain doesn't go away. But for me, I was always in the survival state, always afraid, and I never wanted to go anywhere and do anything, or I dreaded it and I didn't know how to calm my body. So when I went and did things, I was just thinking about when I could go home. Now, I will say I do still struggle with that. Like this past weekend, I went line dancing with my husband and my friends, and I had a great time. But I was having some chronic pain pop up again, and it comes and goes. That's how it can be a sign to you if you have nervous system issues, if it's not just like a medical thing, if it's also nervous system. Because if you have, like, for me, burning when I pee, if it's a UTI, you'll go to the doctor, get a urine sample, it'll show the bacteria. You'll take an antibiotic, and then boom, I'm not going to say boom, you're better, but usually if you have a UTI and you're able to use antibiotic, you get better. But for me, if I went to the doctor and I had a urine sample and it came up, oh, you don't have a UTI, they did all these tests, everything looks normal, and they diagnosed me with interstitial cystitis, which is what happened to me, yada, yada, yada. Share that in my other episode as well. But it's the burning. So there's no physical things technically wrong with me, but my nervous system is in such a state of panic that it signals to that place for whatever reason in my body. Anyway, it can be different for everybody. Like alert, 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 something's wrong, when it's really just my body struggling to know that my feelings are I'm just struggling, you know? It's not that there's a threat necessarily, but my body thinks it is, so it sends to that area and it burns, and it's not fun. I don't know how to explain it to anybody other than it's just not fun to have that feeling down there. It's like a stabbing feeling. And for women, we already go through a lot, and adding that on is very stressful. So yeah, in the past, I used to just break down and cry, and I would cancel my plans. I'd lay in bed all day, and I would feel sorry for myself. And that's not like a criticism, like I said, to anybody, including myself. It's just where I was at. But I was feeling sorry for myself. You know, it's understandable. It's a hard thing to deal with, and not everybody understands. They think if you just take a supplement or you take a medicine, you're going to be magically better. But it doesn't work like that with chronic pain all the time. Sometimes you can get treatments and it'll help, and other times it doesn't. It's just really dependent on the person, like I said. And if it's fully health related, or if it's nervous system and something medically wrong that they can fix. But Grace was talking about how once you get out of that fear cycle and you go into more of the calmer cycle with your nervous system, you still will have symptoms, and they may come and go, but you're not going to react like you used to. Your body's going to slowly learn that you're okay. Even when you have these symptoms, even when you're scared to go do something, your body recognizes like, okay, I've sent this signal, but they're not reacting like they usually do, so I could probably calm down a bit. But she also said that sometimes I think people get so upset if they feel like they don't have results at a certain deadline, and I was that person. Within a few months of the program, I noticed some of the ladies in the program already having like barely any symptoms, and I was like, what am I doing wrong? And I still struggle with that sometimes, because it's so easy for us to compare. It's so easy for us to feel like defeated. I know my biggest struggle too is self-compassion, which I also talk about a lot. And being kind to yourself. You don't realize how harsh you are to yourself until you go through something like this. But over the weekend, I started to kind of feel like that. Like I feel like, well, I should be, better by now. This burning's coming back. I don't know what I did wrong, but I didn't do anything wrong. I do all the normal things I do. I do somatic tracking. I do breathing. I do lots of somatic movement. And if you don't know what that is, I strongly encourage you to look it up. I would like to dive more deep into all those things in a different episode, but I kind of just wanted to talk about her podcast and how I've been feeling about it and how I want you to kind of take from it. But I think it was just hard. And you know what I did? I did breathing. I did somatic movement. I walked away and did kind of swaying is sometimes helpful for certain people depending on what comforts you. I just took some time for myself, and it did go away. Now, when I went line dancing, and I felt good, but then when I start to get anxious because I get social anxiety, or I start to think, well, what if I'm bad at this? Or what if I said the wrong thing because of the people-pleasing aspect? Then it comes back. And I start thinking, is it an infection? Do I need medicine? Which I'm sure you've been there if you've had chronic pain and you've had this happen. Or if you just have anxiety in general and you just start spiraling, that was me. But you know what happened when I sat down and I said, this sensation is not dangerous. I am still safe. Yes, it is uncomfortable. Yes, it is okay for me to have these feelings. It, for the most part, went away. Now, don't get me wrong. There's been times when I've said the sensation thing. I've done all these great things and I still have symptoms. But what Grace was trying to say is you're not failing if you still have symptoms. You're not failing if it looks different than somebody else's. You're still on track. You're not going backwards. You're going forward. And I know it feels impossible. Trust me, I still feel it. There's still times where I feel like I did a year ago where I'm like, F this. I don't want to do it anymore. I hate it. Sometimes I get discouraged. But you know what? I now have more tools than I did then. It's all about seeing the progress that you've made. Not looking at someone else. Not looking like what you did 5 years ago. It's good to see the small wins. It's good to recognize where you were. But don't beat yourself up about the past. Don't beat yourself up to where you were yesterday. Think about the things that you did well. And that's one of the biggest things I struggle with is to see the positive in my life. See the good. As you see behind me, all the beautiful people in my life, I try to remind myself, these people love me. These people are there for me, and they don't want to see me suffer either. And maybe they don't always know how to help me, but they're there with me. I'm not alone, because it can feel isolating. So please know that it's normal. If you've been doing this nervous system work for a while, if you're still having some symptoms or it comes and goes, that is completely normal. And that's actually a sign that you have neuroplastic pain. I hope I said that right. If I did not, let me know, because I'm still working on my words. But it's a big sign that it's probably nervous system. Now, that doesn't mean to not go get medical help. It doesn't mean you shouldn't be careful or check on things, but don't be paranoid like I have, because it just makes the anxiety even more crazy. Like, you can also get different symptoms that you never had before. Like, I had some tension in my hand, some aches and pains overnight, some ear stuff going on, and some of that could be related to just stress. And also, I line dance like all weekend, and it's becoming like a really healthy addiction for me, but it's like I'm tired after. So it could even have been my body stressed out about that. So it's not always necessarily your nervous system, but it can play into it. And I think that that's like something I've been noticing. And I've been trying to tell myself, like, don't jump to conclusions. Now, I will say, my doctor and I have this agreement that if I feel like I have a UTI, or I don't know if it's a flare, I'll go in and do a urine sample, and then they can determine, like, oh, if she has a UTI, then she gets medicine. And that's what I remind myself, that if I need to go to the doctor, I can. But it's not an emergency, and I've been through this before. I even get knots in my stomach, even talking about it now, but it's something that I've been working on for a while. And I just want you to know that it's okay to have days where you just feel doom and gloom, but please know that progress will come. You will get there. I know I will, and you will too. Know that you're not alone in the suffering. There's so many times that even this past weekend, I was just like, I can't do this. I had to walk away and breathe because I was just getting overwhelmed, because I love line dancing, but sometimes I have to take a break. Sometimes I have to step away, and I've also learned that if I'm not feeling up to something, I don't have to do it. I used to force myself, or I used to just beat myself up because I couldn't go. But don't let anyone guilt you. Don't let your own self guilt you, because it's okay to sometimes just stay home and have downtime, but it's also okay to go out and do things. I have like this severe fear of driving, and I have to go to this physical therapy appointment, and I'm nervous about the drive, and I have someone maybe taking me, but I still have to drive at some point, So you have to learn how to just make small steps towards your goals, and to remember that your journey is going to look different, and it doesn't mean that it's not working just because you still have symptoms. And I need to hear this for myself too, because sometimes I just get so upset and so frustrated at this. But I also think the chronic pain, as much as I struggle with it, I know that it's helping me become a stronger person. And I'm not saying that's why you have chronic pain. I'm just saying that sometimes these things that we go through, they suck ass, but sometimes in the end, looking back, I think in a way I needed to go through it because it's teaching me how to work on my nervous system. I was already in counseling before all this, but now that I've, worked on myself, and I've found like some different counselors that specialize in different things that have been able to help me a lot. And I have this nervous system part to it. I can really tell a difference in my body. Even if there's moments where I go back to my old habits, I feel like I have more hope now than I did before. I don't just stay in those old behaviors. I am starting to slowly make my way to, I don't know, like a brighter present day. I like to focus on the present, because if I think too much about the future, I just get overwhelmed. But I'm trying to take each day at a time, and I'm trying to think of the things that I'm doing well, and obviously the things that I need to work on, but not beating myself up so much about it, and learning to not care as much about what people think, which has been really hard for me lately. But I've still been, like I said, working on goals. We'll always be working on goals. It's a never-ending cycle, but it's going to be okay. I highly suggest you check out Healing with Grace, and I hope that you check out my podcast and my YouTube channel. All right, bye.